This could have been avoided. In 2016, a 16-year-old girl went whitewater rafting with her church group at the U.S. National Whitewater Center, where thousands of visitors regularly swim and kayak in artificial rapids. It was a typical summer outing. Water, sunlight, and the controlled rush of fast-moving rapids. At the time, nothing about the trip appeared unusual, designed to mimic natural river currents. Several days after returning home, she began experiencing a severe headache, fever, and vomiting. At first, the symptoms resembled a common viral illness or meningitis. But over the next several hours, her condition changed rapidly. Confusion began to appear. Her ability to respond normally started to fade.
I need to take her to the hospital. Something's wrong. But the virus...
Doctors soon discovered the cause. She had been infected with Naegleria fowleri, a microscopic organism sometimes referred to as a brain-eating amoeba. The organism lives naturally in warm freshwater environments and typically poses no threat when it comes into contact with the skin. But infection can occur if contaminated water is forced high into the nasal passages. Once inside the nose, the organism can travel along the olfactory nerve, one of the few direct pathways leading into the brain. From there, it begins destroying brain tissue. The infection it causes is known as primary amoebic meningoencephalitis, a rare but extremely aggressive disease that produces massive inflammation and swelling inside the skull. Doctors immediately placed her into a medically induced coma and began an aggressive treatment protocol combining antimicrobial medications with therapeutic hypothermia, lowering her body temperature in an attempt to slow the damage occurring inside the brain. For days, her condition remained critical, but gradually, the swelling began to stabilize. Weeks later, she emerged from intensive care. She had survived, becoming one of the extremely rare documented survivors of the infection. The organism itself exists naturally in many warm freshwater environments. Millions of people encounter it without ever becoming infected. But infection does not begin when the water touches the skin. It begins when contaminated water is forced upward into the nose. Because from that moment, the organism has a direct, silent path to the brain.